Evening and welcome to the November community meeting of the Queen Village Neighbors Association. I'm Eleanor Ingersoll, Association President. Tonight, Dr. Kathleen Sullivan joins us for the third time. Chief of Allergy and Immunology at Children's Hospital of Philadelphia, Dr. Sullivan joined us back when the Pfizer vaccine was just in trials, and again to discuss the rollout of the vaccination protocols, as her specialty focuses on new and rare immunodeficiencies. As we enter the second winter of COVID-19 pandemic, Dr. Sullivan is here to discuss some key points, beginning with how will the winter shape up with a lens on expectation of spikes, the prognosis for potential variants, booster shots, the pros and cons of changing up manufacturers, and immunizations recently approved for the 5 to 11-year-old set. As always, this community meeting is being live streamed on Facebook and at Queen Village Neighbors Association, as well as being recorded to be made available on our website at qvna.org. I invite you to stick around for the final announcements. The annual QVNA elections, normally held live at previous in-person November community meetings, were instead shifted to voting at our office over the last 10 days. Though not a contested election cycle, the official process of holding elections and announcing results is key to the transparency of bylaws for any democratic organization. Thank you so much to all who voted. So without further ado, and before I pass it off, I want to say that we look forward to addressing your questions and concerns. You can put them in chat, and we will also look for them in the Q&A section at the bottom of your Zoom screen. As the more information we can share, the better. So without further ado, I welcome back Dr. Kathleen Sullivan. The Zoom floor is yours.
Thank you, Eleanor, and thank you, Lucy, as well. Let me just be sure I have shared appropriately. How's that? Does that look good?
Excellent.
Okay. All right. Well, thank you for having me. It's an honor. And of course, I'm very rooted to Queen Village, so I'm happy to do this. And I was asked with sort of deciding what the state is right now, which isn't as easy as it sounds, and then where we're going, which is even murkier. But I'm going to try. I'm going to give you some information that I hope is useful to you. And my presentation will be about 20 to 25 minutes. We wanted to leave a lot of time for questions. So I'll keep you apprised. This is really the outline of what I want to cover. Where are we at right now? And then the winter is a particularly problematic time. So I do want to cover that. And then I'll end with a discussion of vaccines and how to mix and match and what it means for children. So we are at this very unusual place where we have lived through one of the most important societal transformations of the century, and 1 in 500 people have died. I don't want to linger on the gloominess, but people have suffered personal losses, and people who have viewed this view it in different ways. I'm going to come back to that. I think some people are glasses half full, some people are glasses half empty. So I want to start with just the raw data. There have been a lot of deaths. Fortunately, the trend is looking better, but we can't ignore the fact that this has really changed the way our society operates. And it's been a roller coaster. So these are two graphs that capture the entire pandemic. So in the bottom, it's deaths starting from the beginning, so January roughly, and through November 2nd, when I took the extraction. And then the top blue is cases. And you can see, depending on how you look at it, there have been 4 or 5 waves. It's really been a roller coaster, which has impacted us in a variety of ways. And so we have to bear in mind that we are still in an unstable state. I think we're getting to a level of stability, but we are not, I don't think we should take this virus for granted and imagine that it's over and done with. It's been a surprise all along. And this roller coaster has led to changes in social practices. It's definitely impacted the economy, mental health. And some of us share the same experiences. We have locked down, we've had kids that have been out of school. So some of us have shared experiences, but other people view it through a different lens. They've lost a loved one. They have had to not see family members that are near and dear to them. And so I try to always recognize that everyone is coming at this risk profile from a different set of experiences. So I never want to judge. Tonight, I want to give you some information, and I'm going to share with you what I think is reasonable, but I never second guess people. I have a friend who still double masks when she goes outdoors. I don't, but she's not wrong. I think that's where she's at. So we have to respect that everyone is kind of at a different place with their risk assessment. So let's talk about the current status in Philadelphia. So there's been a lot of emphasis throughout the pandemic on the public health, and there's reason for that. So when the hospitals are full, someone who sprains their ankle on the sidewalk can't get in. There's no one to x-ray them, the bays are full. So the focus on hospital capacity has really dominated. This is from last week. And the red are states that have almost no ICU capacity, which is a marker for the hospitals are full. And then the more green are the states that have essentially normal access. So we're light green. So we're doing pretty well in terms of our hospital access, which means that if you need to do your routine screening, you can be seen. It's not the crunch that it was at the height of the Delta virus. So there's good news from the public health perspective. And I mentioned this last time I was on, where I work, there's a group called Policy Lab that does projections. I can't tell you what the algorithm is that projects out, but I did want to share with you some good news. They're projecting further declines throughout November, and they did take into account Thanksgiving. So because of the rising vaccines, Policy Lab is projecting that the case counts will fall in Philadelphia. And this is from the Department of Health website, which any of you can access. It's looking at vaccination rates across different ages. So the vaccine uptake in Philadelphia is actually quite good for a large city. Philadelphia has really done well after the initial wave. I think there's been a lot of public health emphasis. I think there's been a lot of effort at messaging. So the vaccination rate, it's not perfect. I don't want to tell you that it is, but honestly pretty good compared to other large urban centers. And there are some differences according to races and ethnicity. And I think that we need to do a better job of providing information that is meaningful and resonates with individual populations that might be more reluctant. Now, if you read the Inquirer this week, you read this shocking statistic where 90% of Philadelphians have had at least one dose. That probably is a little bit of an overstatement. It probably incorporated some people with boosters as their first dose. So it's probably a little bit rosy. But again, to make the point that Philadelphia is really doing rather well compared to other large urban centers. So from a public health perspective, which is reasonable to think about, this is all good. People can get into the hospital for procedures. If you're trying to do routine screening or blood work, you can get there. The vaccine rates are still climbing, although the rate of increase is slower. People are still signing up for vaccines. And the case rates are relatively low in Philadelphia. So from a public health perspective, there's not any sign of crisis. It's not that the hospitals are going to fold up and be overwhelmed. But how can we translate this into our personal behavior? This is all good, but how can we interpret this from our own desires to go out and about? So I'm going to start with how worried do I need to be about asymptomatic spread? And this message has changed a lot over the course of the pandemic. Initially, the only people being tested were those who had symptoms. So it was really unclear whether there was much asymptomatic spread, although in retrospect, there were a few clues along the way. But we now think about 30% of infected people are asymptomatic, and they are capable of spreading the virus. It is age dependent. So children and young people more likely to be asymptomatic carriers than older people. So there's a little bit of a age dependency, but overall about 30%. Now, the children are important to recognize because they currently, in Philadelphia, they represent about 24% of all reported cases. And this is largely due to Delta virus. So the initial strain of virus was not very transmissible in children, but Delta virus is. And so we've seen correspondingly more and more infections in children. So we are not quite back to normal yet. I know everyone wants to be there. And so if you're thinking about your personal risk, you want to sort of stop and think about what those risks are. So speech is the main form of transmission. If you've ever been at a play and you've watched the actors, you know that when people speak loudly, saliva comes out. So it happens when we talk more normally as well. It's not the only mode of transmission. So any cough, any sneeze, of course, can do it. But over time, we've come to de-emphasize surfaces. So I suspect many people on this webinar, like me, sort of washed off our groceries and our cans and tried to be really cognizant of touching surfaces. That's probably less important than aerosol and droplet spread, but it can still happen. And in Philadelphia right now, the current test rate positivity is 4%. What does that mean? So of people showing up for testing because they had an exposure, they need it for travel, they need it for work, they are ill. So among all of those people, it's about 4%, which is fairly low compared to most of the pandemic. So again, all good signs, but it's still out there. So I would say, no one wants to hear this, but I would say masks are still necessary. And I'll just take a moment to remind you that masks really protect others. So for the wearer, the masks are about 5 to 10% effective. So this is for a standard surgical mask, one of those blue paper things that sort of gap at the edges. If you double mask, if you twist the loops around your ear to try and make a seal, or if you have a better mask, the protection goes up. But just a standard surgical mask slapped on your face, it offers some protection, but it's not great. The main role of masking is to prevent transmission to others. And of course, the optimum ideal situation is when both people are masked, because then you prevent the spread and you at least have something between you and the aerosol / droplet. So masking helps. It's really a public health effort, not so much protective for the person wearing it. Although, as I said, you can do things to increase the efficacy of the mask. What about social distancing? So outdoors is safer still. You've heard this a lot. You want to maintain about 6 feet of distance. Is this perfect? No. If someone coughs or starts singing, or the droplets can go more than 6 feet, but if you're just having a conversation, it's pretty rare for droplets to spread more than 6 feet. And what I would say is, I think we all crave human contact. I think we are so ready to be with our friends, our relatives. And I hear it so often. Can I get on a plane? Can I go? Is it time yet? And I think with precautions, I think it's important. We have to care for our mental health as well as our risks of COVID. But again, everyone is going to make their own risk assessment. I don't want to judge, but I have certainly encouraged my patients and my friends that if they have a reason to travel, someone they love that they haven't seen for a long time, this is probably a good time right now. Later in the winter, I think it's less predictable, but I think right now is a good time to go. And I know many of you are thinking about Thanksgiving. If everyone at the table is vaccinated and no one is acutely ill, I think it's quite reasonable to get together. But again, different families are going to make different risk judgments. I know we all want it to be over. I think everyone is frayed and exhausted. I hear you. I wish I had better news for you, but it's not over. And the end is probably not a date at any point. So let's look ahead. So I don't have a crystal ball. So I'm going to tell you what we think, but I definitely do not have a crystal ball. So this is an assessment based on epidemiologic factors that we think will come into play this winter, but please don't take it as etched in stone. So I want to tell you about this concept of infection debt. So I did not know about infection debt, but it came up quite a bit at CHOP. And so let me share it with you. So the idea is that if you look at the left-hand graph, which is cases of chickenpox in different years, you can see that there are big swings. And after a year with few cases, there tends to be years with more cases. This happens for almost all viruses. Influenza is particularly true. I've also shown you RSV. RSV also has big swings. And so after a low year, you tend to have a high year. And the idea is that in the years where there's relatively little transmission of these viruses in the community, there's a cadre of kids who grow up that don't have immunity, and then they are very susceptible when it comes around seasonally. And so there is this concept of infection debt. It is described for many viruses, and one of the ones where it is best described is influenza. So the concept is a light viral season is followed by a severe viral season. Last season, we were all masked and indoors and socially isolating. So there was hardly any influenza in the city. In fact, I don't think I saw a single case. And so that leads to this notion of infection debt, that this winter, there will be a price to pay, and there will be more circulation of common respiratory viruses. So you've heard people say on TV, you've heard people plead, you've heard ads on TV. So I'll just reiterate, this is what's driving the desire to get everyone vaccinated to flu. It's really critical this year for a couple of reasons. One is we do think it's likely that there will be high levels of flu in the city or across the country. It's already growing in New Jersey. There's only a few cases in Philadelphia, but the numbers are going up, which is typical for this year. And so why is that a problem? Well, coughing for any reason, let's say someone would otherwise have asymptomatic COVID, but now they have flu and they're coughing, they're wheezing, they've got droplets on their hands. So they're going to be more likely to spread COVID as well as flu. And then lastly, there are a long series of studies that people who have two respiratory viruses at the same time are more likely to land in the intensive care unit. And it makes sense. How can your body fight two things at the same time? So if you wondered why there's such a push for the flu vaccine when really we're worried about COVID, that's the reason. It can act as a facilitator of spread, and it can also increase the likelihood of landing in the ICU. But what will COVID look like this year? So this is especially murky. So if there are no escape variants, so escape variants are virus variants that are no longer suppressed by the immune system. And it's more complicated than that. There are escape variants that only escape antibody. There are escape variants that only escape T cells. But the concept is that people who would otherwise be immune to the new escape variant virus, that immunity doesn't work, or it doesn't work very well. So if there's no escape variants, which is a really important caveat, the thinking is that COVID-19 will become endemic. So it's going to sort of percolate in the community and bubble up in little clusters. So instead of sweeping across the country and being regional and taking out whole healthcare systems, it's going to be in a school, in a church, in any kind of gathering place. And so that's the idea of an endemic virus, and that is what the other coronaviruses are. They percolate in the community, largely in children, some in adults, and then in certain settings, they sort of pop up as little clusters. So this is good for the healthcare system because it's not sweeping across whole regions and burdening the hospitals, but it's still worrisome for vulnerable people. So the elderly who maybe don't make great responses to the vaccine, people who have compromised immune systems and are not responding to the vaccines at all. So it is still worrisome, but it's a better plateau than where we've been. So I think that this vision of it bubbling up in small ways, as long as we can keep the vaccination level high, is again, not where we want to be. I think we want it to be over and done, close the book, move on, but it is at least better than where we've been. And I do want to give credit to our new Philadelphia health commissioner, who has really worked hard to sort of make sure that there are resources in place that can both identify and provide guidance and resources for little clusters that bubble up. So let me transition and talk about vaccines now. So the COVID-19 vaccine. So if you are on this webinar and you have not been vaccinated, you should know that 3 billion people around the world have been vaccinated. In the US, 192 million people have been vaccinated. There has never been as large a concerted vaccination effort. And there is more than a year of follow-up. So particularly for people like me in healthcare, we got our vaccines, and now you have a year of data, a year of follow-up, and you can ask, are there any side effects? So no effect on fertility, which was one of the more common concerns I heard from women. There certainly is no magnetism, which was, I think, a little myth that was out west. So they're very safe, and the FDA continues to collect data to ensure that there's nothing that burbles up late that might be a side effect of the vaccine. And what about efficacy? So the mRNA vaccines, which is what I'm going to focus on, are 90% effective against hospitalization. That's extremely good. I wish it was 100%, but it's really quite good. It's better than flu. It's really, these are strong vaccines, which is why they do have some, we say reactogenicity rather than side effects. So people get fever, they feel a little crummy for a day after getting it. For people that are immune compromised, so people who have cancer, people who are elderly, people who have, for various reasons, they're on drugs that might compromise their immune system, these vaccines are still quite effective. It's really remarkable how strong and potent they are. So that was for people who might have some reluctance still about the vaccines. If you've had the vaccine, now is time to think about boosting. And so why? You probably thought, I'm getting my 2, I want to move on. I had some fever with it, I wasn't that comfortable. Here's why. So if you look at the graph on the left, you can see that antibody levels decline over time. So the x-axis is days after the vaccine. Now, this is not abnormal. This is true for every single vaccine. So this is not peculiar to these vaccines. All vaccine, we say titers to calculate the amount, they go down and they actually plateau. So usually at about 3 months, then they hit a plateau. And after 6 months to a year, usually the decline is very, very slow. Not nothing, but very, very slow. Well, what if you compare the vaccines that are available here in the US? So Moderna, Pfizer, and Janssen. So you might have heard, oh, Moderna is so much better. And you might have, tried to sign yourself up and get the Moderna vaccine because it's better. It was based on this one paper that compared the vaccine responses and the durability to Moderna, which is in red, Janssen, which is in blue, and then Pfizer, which is in gray. And I have to say, the other studies that have looked at this have found equivalence between Pfizer and Moderna. This is the one study that found a difference. But Janssen typically is lower than the mRNA vaccines. And that's one of the reasons you might have heard, if you got the Janssen vaccine, you should definitely sign up for a booster. Who's eligible for a booster? So right now, it is political. Goodness, everything in COVID-19 is political. So right now in Pennsylvania, for Pfizer or Moderna, it's restricted to people 65 years and older, or if you are an adult in a long-term care setting, if you have an underlying medical condition and they don't specify and they don't quiz you on it, it's any medical condition. Or if you live or work in a high-risk setting, so that would be something like a group home, a prison, a hospital. So those are the criteria right now for Pfizer and Moderna. The Johnson & Johnson vaccine, everyone who's more than 2 months past their vaccine should get boosted.
They're speculating that the FDA is going to boost this for everybody tomorrow.
So my husband is telling me that on the news right now, they're saying the FDA is likely to suggest that everyone get a booster. So that's where we're at right now. I think you've seen the news that in New York, they're already recommending boosters for everyone. I think it will become a universal recommendation. I think it's too hard to administer select patient groups. So I'm not surprised by that. But amazingly enough, it's on the news right now. So some super common questions that I get all the time. Can I mix and match? Absolutely. There is no harm. You can mix and match. You should go to your pharmacy and get whatever one they have. There's no data to say that 2 of Pfizer and 1 of Moderna is better than 2 of Moderna and 1 of Pfizer. There's no data. The boosting is the thing that gets your antibody level up. Am I going to have to do this every year? Oh, we don't know yet. I think there's some likelihood, but we don't know yet. If you think about standard pediatric vaccines, we do retain levels for a long time after 2 or 3 doses. So it's not a foregone conclusion that we will need it yearly, but certainly I think people are preparing that it might need to be a yearly vaccine. Does my vaccine work against the Delta variant? So all 3 vaccines in the US, Pfizer, Moderna, and J&J, work very well against Delta. There were a lot of concerns early on. There is a little bit of a decrement. It goes from about 90% efficacy to 85%, but the decrement is actually quite small with Delta variant. And then the question I get asked maybe more than anything else, what about new variants? So coronaviruses mutate very rapidly. And in principle, they can become resistant to antibody. Those are the escape variants I talked about. The good news is that the mRNA technology is really nimble. So if we do need a new formulation of the vaccine, it's not going to be a year until it is released like it would be for flu. So these platforms are very nimble at adapting to new strains. So could it happen? Yes. I'm going to show you some data that makes me think that it's not as likely as was initially feared. So I've emphasized a lot of antibody. I've showed you graphs about you get more antibody early, less antibody late. That's why you need boosting. Differences between the vaccines. What's the fuss about antibody? So these are survival curves of breakthrough infection. So you'll see there are 4 lines. There are 2 kind of overlapping. So the 2 at the top are showing you that there are fewer breakthrough infections at the highest 50% of antibody. The red line is the next quartile of antibody. and the blue line is the lowest response to the vaccine, and they have the highest number. So that's exactly why there's so much emphasis on get your booster, we need your antibodies high. You want your antibodies as high as possible. And I'm going to explain why the antibody is all that in a minute, but let me also address the question of, do I need to get vaccinated if I had COVID? Isn't a natural infection better? So across the spectrum of diseases, it's true that there are some natural infections that induce higher immunity than the vaccine, but there's way plenty where the vaccines induce higher immunity than natural infection. And so in these graphs, the y-axis is the amount of antibody, and the amount on the left is after natural infection. And then the middle graph is antibodies after the mRNA vaccine. It's the same scale. You can see you get a lot more antibody out after vaccination than you do from natural infection. And if you look at the frequency of breakthrough infections, the folks that have breakthrough infections, which are on the left in the right-hand graph, they have overall lower levels of antibody. But you'll notice it's not a clean line. You can't say if you have this much, you're fully protected, and if you have below that, you're not protected. Sadly, it is not that clean. And this is why. So the antibodies are sort of sponges. So when someone coughs on you, the antibodies bind to that virus and take it out of commission. So the more antibody, the more likely you are. But if someone has a really giant cough and there's a ton of virus in it, you might not have the same capacity to neutralize that virus as if it's a little cough with a little virus. So that's why it's not a fixed line. We will get to a point where we know what a roughly protective level is, but it's been amazingly hard to decide because breakthrough infections have been different with Delta. So it's sort of been a moving target. So we don't have a threshold yet, but we will get there. We will have a point where we think 80% of people should be protected. So to sum up, I know that was a lot of data and a little bit hard to digest. So the higher your antibody level, the less likely you are to have breakthrough infection. And that's driving the desire for boosters, and it's driving the desire to really get people fully vaccinated, not single dose vaccines. And let me just mention variants. So it's come up a couple of times already. So I showed a slide like this when I spoke before. So all viruses mutate. So this is on the left, a family tree of SARS-CoV-2, the virus that causes COVID-19. Way over on the left is the virus that started in China. And then you'll see there are different branches. So these are different sets of mutations that establish themselves in the population. And the big kahuna at the top, that is Delta variant. And it's really swamped out almost everything else. And if you display it as a pie graph across the world, the Delta variant has really outcompeted everything else. And you can best see that here. So this is now a scale from November of 2020 until I think last month when I took this screenshot. The Delta variant is in green, and what we're looking at is percentage of different strains in the population. And you can see that once Delta takes hold, it outcompetes everything. There have been variants that technically represent escape variants, but they just aren't as fit. They never grab a toehold in the community. They're not as able to replicate. They're not as able to spread. So Delta variant has completely swamped out everything else at this point. And let's end with a little chat about children. I'm a pediatrician, so very near and dear to my heart. So thus far, there have been 1.9 million cases. There's been a lot of, I would say, some difficult messaging about how vulnerable kids are. And part of it is that it has changed over time. So with the original strains, children were not very susceptible, not that they didn't get sick. I certainly admitted and took care of many kids in the ICU. But Delta variant infects younger age groups. And so overall, we're at about 1.9 million cases of kids, over 8,000 hospitalizations. You may have heard that in kids, they get this peculiar inflammatory syndrome where they have high fevers and their body sort of shuts down. That's called MIS-C. Over 2,000 cases of that. It is terrifying to see. Now we have a protocol to treat it, but I remember so clearly the first child that I saw. And although it is still terrifying for parents and families, it is imminently treatable. But in spite of that, there have still been over 100 deaths. Now, just as a reminder, Zika only affected 6,000 people total. You remember Zika, right? Zika came up from Brazil. It caused microcephaly. A lot of lot of panic about Zika, and it affected overall less than 100 babies in the US. So by comparison, COVID-19 is definitely impacting the pediatric community. So where are we at with vaccines? So right now, it is the Pfizer vaccine that is approved. Moderna is pending approval. It's unclear if it's unclear if the Johnson & Johnson vaccine is going to seek approval in the younger age ranges. And it's just as effective in kids, even though it's a lower dose, as it is in adults. The kids do get a smaller dose, but they're also smaller people, so they get the same efficacy from it. So the overall rates of protection are comparable to what we see in adults. So I'm just going to finish up now. What about beyond vaccines? Is there more to think about? So one thing you should know is if you are high risk and you get sick with COVID-19, all the major hospitals in Philadelphia have this thing called the Regeneron antibody cocktail. This is synthetic antibody that is meant to sort of supplement whatever you have, and it is meant to protect you early in the course of infection. So it clearly lowers the progression to severe disease, but it does have to be given early. You can't wait until you're coughing and wheezing and can't breathe. You have to give it at the time. You have to give it within 10 days of symptoms, so you don't have an infinite period of time. It is quite effective. You have no doubt seen on the news that there is a pill by Merck. So the first one to be announced was the pill by Merck, which is called Molnupiravir. It halves the risk of hospitalizations and deaths, so it is effective. It's better than what we had before that. So, and now there is newly described the Pfizer pill, which is called Paxlovid, and it results in a dramatic reduction of hospitalization and death. These are not FDA approved. They are before the FDA right now. What the timeline is for approval, I don't know. So there are some options. If you are a very vulnerable person, perhaps you have lung disease, perhaps you're elderly, you should know that if you get sick, there are options to try and minimize the likelihood that you end up in the hospital. All right, so I'm going to stop screen sharing, and I am happy to try and answer questions. I don't know everything, but I'm going to try to answer as best I can.
Well, Dr. Sullivan, thank you so much. As usual, there is a ton of information, and you did a fantastic job of making it quite accessible and understandable. I just want to review a couple of things. So the prognosis for potential variants, Delta is still very much powerful and surging, I am guessing, and therefore we can't expect another one, or it's too difficult to pinpoint if there will be another one. How, because I can't recall precisely how predictable Delta was, or if it was identified early and realized that it was going to be the tsunami that it is.
So that's a great question. Predicting mutations and escape variants is not a precise science. So there's a lot of surveillance going on around the world to try and pick up these variants before they grab a toehold, although our tools to mitigate the risk are fairly limited. But there's a lot of surveillance going on. There's a lot of interest in doing the sequencing, which is expensive and difficult. It's a significant undertaking by the countries that are doing it, but it's completely random. So the mutations happen randomly in the virus, and some subset may allow immune escape. So it's completely unpredictable.
So the focus on Delta is the best that can be done right now with the tools at our disposal.
Yes, and Delta, as you know, it is more transmissible. So each cough has more virus in it. The virus is also what we say is more fit, meaning that it is more able to infect the cell and reproduce itself. So it outcompetes essentially everything else. So it would take a particularly hardy strain to be able to escape the immune system and outcompete Delta. But we need to look and be sure, not guess.
Then again, I don't know if this question does have an answer. Is Delta being managed? Is there hope that it will recede, or is it basically the in lockstep with COVID as just kind of the stronger cousin?
It is really the strain that dominates around the world right now. There are just tiny pockets where there are alternative strains. It's just that much more fit and more transmissible. So Delta is what we have now.
Okay, that's very fair. And, you know, as you were talking about, besides boosters and even getting vaccinated if you haven't yet, One of the other safe things, the other safe measures that can be taken are mask wearing and social distancing. There is an interesting situation going on in Pennsylvania as the PA mask mandate, which of course affects schools, is currently headed to the Supreme Court to be, I don't know if repealed is the proper word, but the Commonwealth Court ruled that the mask mandate decision should be left to individual school districts. And now that is proceeding to the Supreme Court, there will be an ultimate decision. However, right now, until we hear further, in maybe early December, the mask mandate is expected to be left to individual school districts to decide. Now, the most recent thing that we have heard is that the Philadelphia School District will observe the safety measures and keep the mask mandate in place for the foreseeable future. But it is interesting that that is something to contend with, and that it sounds could very well likely be left to individual choice.
I think it's been so difficult. Who would have guessed that masks would be so political? They're such a minor public health strategy, but they've become political. They are seen as an infringement by some, but there's no denying that they work. And so I think leaving it to individual school districts, it may reflect the community sentiment in a way that people can capture. But it bothers me that there are all these fights at school boards over masking. I honestly don't think the kids mind very much. I think it's the parents that mind, but that's me opinionizing. So I'm sorry that it has become political. To me, it seems like a really straightforward public health maneuver.
And we will watch and wait and see what happens there. But on kind of a lighter note, it is important to remember that we're coming into the holiday season, specifically Thanksgiving next week. And it's really tough after such a long shut-in and social distancing that just last Thanksgiving, we were all very much within our very personal unit of people that we were interacting with. And then we had a wonderful summer where everyone was ready to, throw the masks in the river, that we shouldn't do that. And then of course, Delta arrived on the scene. But it's still, it's not a complete damper on the Thanksgiving holiday, because as you said, if you're around a table with a bunch of people that have been vaccinated, or people are taking the test, the antigen test, before sitting down to break bread, you can still take those steps back to normalcy of celebrating with friends and family around this holiday season.
Yes, thank you for emphasizing that. I think it's so important. I think mental health has really suffered. We are human beings and we thrive on our social connections, our family connections. And so if there is a way to have Thanksgiving or to be a part of a Thanksgiving celebration safely, I think people should definitely do that. I think we are all eager to reestablish those connections and to have some traditions that feel rooted for us. So I'm glad you brought that up.
And just to piggyback on that, as we were discussing before we even started, that in light of all the steps and measures people are taking to make themselves safe, it is also important to focus on mental, emotional, and social aspects of health too, because those are very, very important factors.
Yeah. The rate of suicide has never been higher, just to pick one metric. It's really been very difficult. I think everyone has suffered in their own way. Some people are a little rosier and have found coping strategies, but there's no question but what it's been very, very difficult. And so I'm eager to help people find safe ways to try and reconnect and reestablish the communities and the connections that make us the social species that we are.
And to follow up, that while children under 4 aren't eligible for shots yet, they are largely protected if they are surrounded by vaccinated people.
Correct. And even with Delta virus, the under 5 group is less likely to transmit virus. Not that they can't, but they're much less likely to transmit. So I do think with some accommodation for kids, I think gatherings can be done safely.
This is really, really, really good news. And though we were light on the questions, because maybe people have started their holidays early this year, I do want to reiterate that the major takeaway from tonight is that booster, if you haven't already been vaccinated, of course, get vaccinated, but boosters are going to be the most important way that anyone can defend themselves against the Delta variant.
I think boosters, if they're rolled out for everyone, and certainly for the vulnerable people that I listed, and then don't forget the flu vaccine. I know it seems like an afterthought, but you don't want to be coughing and simultaneously spreading flu and COVID. So don't neglect the flu vaccine this year. And you can get the vaccines at the same time at most pharmacies.
So I've heard people, trying to decide which arm will be affected most, but maybe the best bet is to try to do it when you have a day off or around a weekend. Just give yourself that little padding for necessary, rest, R&R. And because even though as you said, the predicted case counts or the case counts are predicted to fall, it is still important to be vigilant.
Yes, that's a great way to say it. It's not gone yet, but we have at least some opportunity to engage with others in a safe way.
Excellent, because while not a fan of the flu vaccine, I did have a personal scare. My son got desperately sick back in September, and regretfully, it was very, very tough to get a test anywhere in the city. So we ended up at CHOP, thankfully, and went through all the tests, and they said, this is just, as you described, these other variants, not variants of coronavirus, but other viruses spike. And they said, and it's not the flu. He'd be our very first flu case because it was over Labor Day weekend. But it was a reminder then and there that I thought, I'm not going to go through this again. We're going to get the flu vaccine. We're going to take all available opportunities to make sure that we keep the adrenaline at a minimal level around sickness fear.
Yeah, that's a great way to think of it. Do all that you can to prevent drama. Absolutely. No one wants to be trying to manage illness over the holidays. That's a great way to put it.
Well, Dr. Sullivan, I want to thank you so much for coming and giving us so much valuable information. Unfortunately, this will be available on our website at qvna.org because I can personally attest to people contacting me afterward, thanking me for these recordings being available so they could review the information, write things down, rewind, whatever the case may be. But we're all very lucky to have you as an asset in this neighborhood to be able to shed some light on these things. And I really thank you for coming. And I can't promise you it will be the last time. As we joked, I'm going to have to give you a jacket like they do on Saturday Night Live as a repeat hostess.
That's very kind. I'm happy to do it. I'm very rooted to Queen Village, as you know.
Thank you.
All right.
Thank you so much. I appreciate it. And then I also, as I said earlier, November is our traditional annual elections at QVNA. And though this wasn't a contested go around, I am welcoming the board member, Michelle Grimley, who is also our chair of the nominating committee, to review the candidates and the slate coming into QVNA for the 2022 term.
Thanks, Eleanor. Hi, everybody. Happy Wednesday. I'm Michelle Grimley, and I have non-medical news to share. As Eleanor said, I'm going to talk about the candidates. We're very excited. First, I'd really like to thank everyone who came to QVNA's new office to vote in person. Really appreciated. Thank you. Now, drum roll. I'm proud to announce that the following new members of our board for the 2022-2023 term will include Kate Allen for treasurer, Chris Mullen for secretary, and our newly elected directors include Danny Doyle, Don Finley, Philip Hausheyer, I said that right, and Noah Swistak. So super excited. It's going to be a great year.
We want to congratulate everybody for the win. We want to thank everyone who voted. We are very excited to undertake continuing service to QVNA in the coming 22 to 23 terms with these new directors. And Michelle, thank you so much for manning the nominations committee. We appreciate your dedication and your volunteer hours. So I want to thank everybody. This was a very succinct community meeting. As I said, we have daylight savings. We have a holiday next week, and then we are off to the races for the rest of the holidays throughout December. I want to wish everybody a safe and happy holiday season. We will resume our community meetings in 2022. So we look forward to letting you know what's coming and when you can participate. Our magazine is due out at the beginning of December. That's the Queen Village Quarterly Crier. So please look for that, to lots of our lifestyle articles around what's happening in Queen Village. And lastly, Saturday, we are proud to bring you our electronic and recycling event, which is sponsored by Representative Mary Isaacson and her office. And she will be joining us. I believe we will also be seeing Mark Squilla and Representative Dwight. And remember that it's anything with a plug. So I will be bringing an old Xbox that's been kicked around the house, and I'm happy to get rid of that. Unfortunately, no batteries, but if it's got a plug, bring it. We will also be shredding. So if you have any sensitive documents, now is the time to get rid of them and come by and say hi. We look forward to seeing everybody, and we're really hoping for nice weather. And without further ado, then, I think we have covered just about everything. Again, I'm Eleanor Ingersoll from QVNA. We thank you so much for joining us tonight. We look forward to seeing you in the new year, and I'm wishing everybody a very safe and happy holiday season. Have a great night.